Hi, Mrs. Smith. My name's Jill. I'm going to be your nurse today. Are you doing okay? All right, great. Can you verify your name and date of birth for me? All right. Do you have any allergies to betadine, iodine, or latex that I need to be made aware of? All right, great. I'm going to raise your bed to a comfortable working height for me. Today we're putting in a Foley urinary catheter. It's going to go in through your urethra and into your bladder to help drain any of that urine that you've been having some issues voiding. And that order is from your physician. I'm going to pull back your covers and I'm going to raise up your gown and expose you, okay? Do you have any questions about the procedure? Great. We're going to start with some perineal care. So I'm going to wash my hands and put on some clean gloves. And since you're a female, I'm going to need you in dorsal recumbent position. If you're a male, I can just have you in supine. Put your legs spread out a little bit. Right. Great. All right, and I have a basin right here with some warm water and some soap. And you're gonna feel me touching, okay? I'm gonna spread the labia and wipe front to back using a different part of the wash rag each time. All right, and then I'm gonna dry thoroughly. Okay, great. I'm gonna remove my clean gloves and dispose. And then now I'm gonna set up my sterile field over here. I'm going to use this plastic bag as a little trash can at the end of the bed. Okay, I'm going to be careful to only touch the outside. Okay, and as I grab my sterile gloves, I'm going to be careful not to touch anything else in the kit since it's sterile. And then now I'm going to put on my sterile gloves after I perform some really good hand hygiene, making sure to get underneath my nails and by my nail beds. Okay. And if at any point in this procedure I were to break sterility, I would have to start over with a new kit. Okay. All right. Okay. And now that I have sterile gloves on, I can touch anything in this kit. I'm going to use my sterile sheet to expand my sterile field this way towards my patient. And I'm going to remove the top part away from my patient. The first thing I'm going to do is attach my sterile water to my balloon port. And depending on the facility that you work for, they might have you test the balloon. They might have you test that balloon. And as you can tell, this balloon is perfectly fine. Okay, I'm going to be very careful not to let that catheter in touch anything other than this box. Okay, then at this point I would empty out my betadine, dispose, empty out my lubricant, and dispose. And then at this point, I can start cleaning the perineal area with this betadine. Okay, you're gonna feel me touching down there. And I'm gonna use one cotton ball to wipe the outer labia, front to back, dispose. The labia closest to me, front to back, and dispose. And then the middle. And since I've already contaminated my non-dominant hand, I cannot touch anything else in the kit with that hand. Okay, and then at this point I can lubricate my catheter about 2 to 4 inches. Okay, and now I'm going to ask you to take a couple deep breaths. You might feel some pressure, might be a little uncomfortable. Okay, we're going to start, okay? Okay. And with a female, I would insert until I see urine return, and then insert an additional 2 to 3 inches. If this patient was a male, I would insert all the way to the Y. Okay, so I have inserted additional 2 to 3 inches. So I'm going to hold the catheter at the meatus firmly, and I'm going to inflate my balloon. Okay, making sure to get all that 10 cc's in there, and then I can remove and dispose. Okay, and then at this point I'm going to pull back my catheter until I meet resistance. Okay, so So I've met resistance. You'd pull back gently. And then I'm gonna hang the bag. And then after I hang the bag, I'm gonna secure it to the patient's leg. Well, I'm gonna secure it to the patient's leg first. Sure, sir. Okay. So I'm gonna secure it, leaving enough slack so that the patient has enough room to move around comfortably. And I have a piece of tape ready to go. Are you feeling any pain, Miss Smith? Are you comfortable? Yes? Okay, great. And if this were a man, I would secure it to his abdomen. Okay? And then I'm gonna hang my bag. And you want to make sure to not raise the bag above the bladder because that would cause the urine to drain back into the bladder. And you do not want to hang this on the handrails. You want to hang it right here, and you want to make sure that it does not touch the floor. And since I just hung this, I could use this as a sterile specimen, but if this had been here for a long time, I would not. And to empty it, you could use a bedpan or a collection device if you needed to measure, and you would unclamp right here, and then have it securely, and then unclamp it right here. And then empty it out into the bedpan or collection device. And then once it's done, you reclamp it right here, and then you put this back. But for this purpose, I'm gonna get a sterile specimen from this port right here. Oh, you need to stay there. From this port, so that it's straight from the patient and it's fresh. I'll pull back. Okay. And then I would take my specimen cup and insert my urine, dispose, and then I would take my urine specimen tag and then put it back and send that out to the lab. All right. Okay. And then after insertion, I would clean off the betadine with my basin of water and soap. Okay. And then you would ask the patient if they were comfortable, if they were experiencing any pain, cover them up, dispose of all of the things that were in your kit, cover them back up, make sure that they're comfortable. Okay. And then laying back down. All right. And for patient safety, you would lower the bed into the lowest position with both side rails up. Dispose. Okay. And of course you would document. Document. Okay. New day. Hi, Mrs. Smith. My name's Jill. I'm going to be your nurse again today. So we have an order to take out your Foley catheter, so that's good news. Can you verify your name and date of birth for me? Okay, great. Do you have any allergies to latex, betadine, or iodine? No? Okay, awesome. Okay, so I'm going to pull back your covers and raise your bed to a comfortable working position for me. Okay. And if there were any urine in this bag, I would definitely empty it and collect it into a bedpan or a collection device. I'm going to pull up your gown, expose you. Okay, and now I'm going to put on some clean gloves after I wash my hands. Okay. All right. I'm going to put this towel down just in case there's any leakage, so we wouldn't have to change those sheets. Okay. I'm going to empty out the 10 cc's out of the balloon. You really want to make sure that you get all of the water out of the balloon so that whenever you're taking the catheter out, there's no trauma to the urethra due to a still inflated balloon. And since it's pressurized, it'll come back on its own. There's no need to pull back. Okay. So the balloon is deflated. You would dispose of that. And then you can unclamp it from the patient's leg or untape it, whichever. Okay. Okay, we're gonna ask you to take some deep breaths. I'm gonna coil this as it comes out, and I'm gonna pinch it as it comes out so that it doesn't dribble. Okay, not doing very good. Okay, we're gonna start, okay? Pull back gently. And pinch. And I'm gonna wrap it up in this towel. All right, it's out. All right, and then you would dispose, and I would get my basin and clean her up some more. You feel me touching? Okay, wipe front to back using a different part of the wash rag each time. Okay, dry. Are you feeling okay? Is there any pain? Are you comfortable? Okay, great. Okay. Then you would cover up your patient, make sure they're good to go, and document everything, how they tolerated the procedure, insertion and taking it out. Lower the bed to the lowest position, both side rails up, documentation.